Fellow Barbadians, just a few days ago, the Minister of Health and Wellness indicated to the country that we had received additional swabs and that he would be ramping up the testing of persons suspected to have contracted the COVID-19 virus across the island. Our laboratory assistants have been working tirelessly through the day and night to provide us with results. And again, I want to take the opportunity to thank all of them, and indeed their families as well, for being patient with them at this time, for their commitment and dedication during this period. Yesterday alone, 175 tests were conducted at the Best dos Santos Public Health Laboratory. Of the 52 test results, which are currently available, I can report at this stage that we have recorded 2 additional positive cases. While we await the results of the remainder of the tests, these 2 most recent cases are of deep concern to us because they are directly connected to 3 preceding cases, and therefore we're seeing a worrisome scenario developing. I've therefore invited the Minister of People's Empowerment and Elder Affairs, Ms. Cynthia Forde, to update you on this evolving situation this morning. Minister Forde.
Thank you, Acting Prime Minister. And here's wishing very warm Saturday greetings to you and all of Barbados. I wish to join thousands of Barbadians in acknowledging and congratulating you for the magnificent job you've been doing in navigating us through this management and implementation of Barbados' COVID-19 response. I believe you and Minister Bostic and his team in the Ministry of Health and Wellness have done an excellent job in sensitizing Barbadians to the seriousness of the challenge that COVID-19 presents and galvanizing our population to confront and deal with the challenge in a resolute and purposeful way. Together with the COVID-19 czar, Mr. Richard Carter, you have presented the facts and made the case for all Barbadians who wish to hear and understand the seriousness of this crisis to follow the public health guidelines and minimize our exposure to the pandemic and all the negative social economic consequences that are associated with it. My fellow Barbadians, I have come to you today consistent with my belief in the practice of open and transparent government. In the Ministry of People, Empowerment and Elder Affairs, we do not have a crisis as yet, but I wanted to sensitize you as to what is happening and, more importantly, to what is not happening in our coordination of this vital portfolio of elder affairs of Barbados at this time. I currently have an entire management team at the National Assistance Board somewhat traumatized by the fact that first 1 and consequently now 4 other colleagues have in the past week tested positive for COVID-19. Let me be quick to add that none of these persons is in a very serious condition. None has even had to be placed under acute care at the isolation centers. The prognosis for each at this time is very encouraging. But I felt I needed to come to talk with you today and to present the facts to you before the rumor and exaggeration created their own story and we found ourselves chasing a national lie. The National Assistance Program is that entity that, among other things, oversees the management and administration of the Home Health Program, which attends on a daily basis to thousands of our seniors and the most vulnerable citizens. I wish to make it clear from the outset that none of the home helpers is to date known to have come into contact with any of the administrative staff who have tested positive for the COVID-19. The administration of the services is conducted from Country Road in St. Michael. Home helpers are deployed directly to communities and work in zones covering homes across the length and breadth of Barbados. Very rarely they go into the office, and when they do, very seldom will they come into contact with the administrative staff among whom the emerging cluster of cases is now centered. The first member of staff who is known to have contracted the coronavirus is not part of the field division, but works exclusively in a clerical position at the headquarters at the National Assistance Board. She is believed to have contracted the virus from a close relative who came into the country and was staying with her, and who subsequently became ill and tested positive for COVID-19 several weeks ago. During the incubation period for that first patient, the relative who happens to work at the National Assistance Board headquarters was completely asymptomatic and continued to work as usual. However, officers at the Ministry of Health and Wellness took the precautionary step to take that staffer into quarantine, testing her for the virus, and discovered, sadly, that she has been infected. Contact tracing commenced immediately, targeting colleagues and persons with whom she would have come into close contact. This led to a decision to quarantine and test all staff at the headquarters of the National Assistance Board. To date, 40 employees have been tested, and while the vast majority has been declared negative, only today another 2 members of staff tested positive, bringing to 5 the total number of National Assistance Board staff that has so far tested positive for the coronavirus. Another 107 members of staff will be tested today. Acting Prime Minister, the Honourable Cynthia Bradshaw, convened a meeting of all relevant officials yesterday evening and has instructed that the arrangements be made for all the staff of the National Assistance Board to be quarantined in local hotels at the government's expense. We understand that this must be a traumatic time for the staff of the National Assistance Board, and the Honourable Acting Prime Minister is organising a series of meetings starting Monday to interact directly with the staff and to assure them of the government's full understanding and support, and also its commitment to assisting them in any way possible in the days and the weeks ahead. Fellow Barbadians, the staff complement of the National Assistance Board is 225 individuals. We have taken steps to ensure that they are all tested as soon as possible, and this process has already started. To date, 5 have tested positive. We pray to Almighty God that all the remaining tests will come back negative. However, we are preparing for any and all eventualities. Our focus now is on the health and wellness of our staff. They are frontline workers in their own right. They have done and continue to do a marvelous job for seniors and the less fortunate families and individuals in our country. I want us all to lift them up in our prayers. We are concerned too about their families, and we have already employed psychologists and other counseling professionals to engage with them and to walk with them through this traumatic experience. Our seniors will be well cared for. My ministry has already formulated a contingency plan to ensure that none of our services to our clients are compromised. Home interventions by crisis staff and other senior personnel had been suspended since early March. We do not anticipate, therefore, to discover any significant degree of interface between administrative staff and home helpers in the weeks leading up to this latest development. However, we are testing everybody just in case. My fellow Barbadians, this is an unfortunate circumstance. It matters not now what could have been done or what should have been done. We are confronted today with a situation that we have as Barbadians to each assume the role and the posture of our brothers and our sisters' keeper. This is a small society, and everybody knows somebody. Let me extend a kind word or a helping hand to anyone you know that is associated with this scenario in one way or another. Even though the vast majority of staffers has tested negative for the virus, it must have been a traumatic experience to first hear that 5 of your colleagues have now tested positive. Let us be sensitive and let us be kind as a nation. Investigations shall continue. Contact tracing shall be intensified. We shall need volunteers. We shall need a database of competent and qualified personnel who can step in at short notice to assist administratively and otherwise. Today, fellow Barbadians, our beloved seniors have not been impacted in any way by this unfolding development, but these are early days. We have agreed to test the entire National Assistance Board staff, including the field staff, known otherwise as home helpers. We are keeping our fingers crossed that all is well in that department. But again, the acting Prime Minister has already drawn up a plan B just in case. Please do not let us run off with idle rumor and speculation. This is Cynthia Forde. You know me. I will tell it like it is. I have told you today all that I know, and I intend to keep you informed during the course of the coming week. The facts are, as of today, 5 National Assistance Board staffers have tested positive for the coronavirus, and this has been traced to one officer, very close interaction with a previously listed positive case. All administrative staff of the National Assistance Board are to be placed into state-sponsored quarantine facilities, even though the vast majority has already been tested negative for the virus. We shall continue to watch and evaluate their progress. This contact tracing that is done by the public health officials is being done for those persons who interacted with the 5 who tested positive, so that we may see if any further persons are affected. Let me stress, no home helper has to date tested positive for the virus. We shall be testing them as well over the course of the next few hours. By extension, no senior citizen has been impacted in any adverse manner by this development, and we pray to Almighty God that this remains the case. I would like to appeal to Barbadians to work with me and work with the government in this matter. It is not beyond us to manage and overcome this challenge. We would rather not be dealing with this issue. We know. But we also know it is not beyond our capacity or the training of our healthcare professionals. Our prayers and the support at this hour are with the staff of the National Assistance Board and their families. We appreciate the work of officers in the Ministry of Health and Wellness. We are cooperating with them and doing all we are asked to do to make this a smooth exercise. Please let the Christian spirit in all of us prevail at this very serious and a sensitive time. I thank you.
Thank you, Minister Forde. I'm going to now invite Lieutenant Colonel Bostic as well, who just a few days ago spoke to the country and indicated that we were not yet out of the woods. I believe that is loud and clear to all Barbadians at this point in time. I think you know that we've extended the public health emergency period until the end of June. And I'm going to ask Minister Bostic to just come to speak to us in relation to not only contact tracing, but also the amount of testing that has been done on the island thus far. Minister Bostic.
Good morning, everyone. Well, you've heard the news from Minister Forde, and I want to thank her for sharing with you and also for working with us in the Ministry of Health and Wellness, and to give you the assurance that although this matter is being taken very seriously, it is not a situation that has overwhelmed us. There was a time in this fight when we were dealing with 5 cases at a time. Now we are into the 70s. We have the capacity to deal with what lies before us. And I have all of the confidence in the world, in the staff, at the Ministry of Health and Wellness, all the public health officials who've been doing this work for the past several weeks. I know that they will get to the bottom of it and that we will be able to do what is required to contain what has to be said to be a troubling situation. So I give that assurance, and we will continue with the level of testing that we've been doing. As was indicated, we've been able to conduct 175 tests overnight. 53 of those results have been returned, and we are waiting the remainder of the results. This exercise will continue this weekend, in particular for the National Assistance Board, where about 104 persons will be tested today, and the remainder tomorrow, so that by Monday, we would have a very, very clear indication as to exactly where we are in relation to this matter. But we intend to stay on top of it. We will dedicate a lot of our personnel and our resources to this effort to be able to deal with it so that we can bring the situation under effective management and control. So once again, an appeal goes out to those persons in Barbados who think that they may be displaying symptoms as expressed recently by the Ministry of Health and Wellness in the enlarged portfolio in terms of persons who would qualify for testing. Come forward and we will arrange the testing for you. And this is the only way that we will be able to stay on top of this situation. And believe you me, we are in control of it at this point in time, and we have the resources to do what is required. I thank you.
Thank you, Minister Bostic. At this stage, I open the floor to questions from the media.
Good morning, Acting Prime Minister Anesta Henry from Barbados today. Can we have the age range of those NAB workers, administrative staff who are tested positive?
I'll ask Minister Forde to just provide that for you.
According to information reaching me, the ages seem to be 60 and 60 plus. In the 60s, because they're all people who are engaged, so they have not reached the age of retirement, except for one who would have been late 60.
Thank you.
You're welcome, Anesta.
Good morning, Minister Forde. Ian Bourne from CETA Radio and Bajan reporter. First of all, Anesta, do you have a follow-up question?
Go ahead, Ian.
Okay, thank you. I was wondering if the person from the National Assistance Board that had started the unfortunate series of events if they would be asked to go on administrative leave or any other form of disciplinary action.
The first one?
Yes, patient zero, in other words.
You repeat your question for me because I didn't hear all of it.
I was wondering if they're going to, if any kind of disciplinary action, or if they're going to go on administrative leave or anything like that, and having started this whole unfortunate series of events.
No, I would not be able to speak to that, but I don't think that that is the route that we should be looking to go at all. Our major focus in the Ministry of Health and in our department is to ensure that everybody's care is looked after, everybody's health is looked after in the most professional and profound way. So I would not want to be able to speak to any matter of that nature now, because if people don't know they're asymptomatic, I don't know. So unfortunately, can't answer that one. I'm sorry.
All right. What about the Alzheimer's Association? Is your ministry working with them? And that is a very significant matter at the moment, because that is a particularly vulnerable area of society that requires a little bit of extra care and attention. So I was wondering if any work is being done with the Alzheimer's Association to get testing done and that sort of thing.
No, we have always had a great relationship with the Alzheimer's Association under Mrs. Pamela Brayton, but at this time we have not had communication with her because we are trying as best as we can to identify those persons, have them tested and isolated or quarantined, and to ensure that the psychological and counseling services are administered to the staff and indeed to the families. But I cannot say that directly, and I can assure you that we now know we have a lot more work to be done, and we're going to be working closer with our faith-based persons and groups to be able to reach out and to offer whatever services can be afforded, because you will appreciate that the faith-based groups and the community-based organizations are very much on board with us to be able to do what has to be done in the interim.
Anesta here again. What additional measures will be put in place to protect frontline workers at this point in time?
That sounds like a Ministry of Health matter. However, let me assure you that the Ministry of People Empowerment and Elder Affairs, in very early March, when we saw what was happening in the world, we acknowledged who our clients were and who our members of staff were, and being on the front line, we ensured that they got proper training. Having designed a strategic plan, we got the Ministry of Health officials and others to come into our departments, and we designed a program called Trainer of Trainers to be able to start with the high administrative staff officials and then to trickle down to our home health officers and even those volunteers to be able to access the training. And you must be assured that we did not leave out the ancillary staff members and the security on our various locations. So we had started very early, and the Trainer of Trainers component had started, and it trickled right into embracing each other. And we also assured finally that the equipment, the necessary equipment, the masks, the temporary aprons, the gloves, the sanitizers, even signs and keeping doors ajar and so on, we made sure that those systems were put in place for all members of the People Empowerment staff, but more particularly the National Assistance Board, because we know of the direct contact that those members of staff will have with our clients across the island.
Good afternoon, Barry Allen here from the Nation newspaper.
Afternoon.
Is for the Minister of Health, please.
Sure.
Yes, sir.
Good afternoon, Minister.
Good afternoon.
My question is on, over the last few weeks, you have continuously said that the country has the capacity to deal with this. But for the first time now, we have a true threat of exponential spread of the disease due to this unfortunate crisis regarding the NAB. Does the ministry plan to only test the family members through contact tracing, or do you plan to actually quarantine all family members of these persons who are employed by the NAB? Because the minister, Ms. Forde, said that there are over 100 staff members that have to be tested. I'm sure each of those 100 persons are in a household and would have come into contact with many persons over the last 2 weeks. So the question is to you, can the
Yes.
government quarantine each and every one of these family members if need be?
The answer is yes, sir. But I want to just correct you there, or rather to elucidate a bit. It is not that we are more or less seeking out family members. There's a process for contact tracing, and that process is followed by a team of seasoned and experienced staff members of the Ministry of Health and Wellness. They have the procedures that they follow, and it will go beyond family members. It will include and involve all persons through their contact tracing method who they consider to have come into contact with those persons who have been infected. And that will include everyone. And that process is already underway.
My follow-up question, Minister, is can you tell us if so far the ramping up of contact tracing, can you tell us if it's been geographically based in any way? Are there any particular, for use of a better word, hotspots or specific areas where public health officials have been asked to go in an effort to mitigate or contain possible spread?
Not hotspots, because like I have been saying all the time, there's no evidence of community spread in Barbados. This becomes something a little different because with 5 persons in an organization, that is a kind of a cluster. And that is why we're taking the steps to ensure that we provide quarantine facilities for all of those persons, because this is one way of us being able to manage this particular development. And I really would like to thank the Honourable Acting Prime Minister and staff for putting these facilities, the Minister of Tourism, available to the Ministry of Health to allow us to be able to do exactly what we want to do.
Good morning, AQ Level Starcom Network News. Minister Bostic, last media briefing you would have said that we have some medical equipment that haven't reached on island as yet. Could you provide us an update on that, where we are?
Well, like I said before, we've been receiving equipment bit by bit. It is trickling into the island. I couldn't give you, because it is so fluid a situation, that I couldn't give you any specifics at the moment, but I would have indicated earlier that we were able to get some swabs, for example. Some ventilators have arrived, some testing kits have arrived, PPEs have arrived, and that process will continue because the government of Barbados had purchased a number of items of equipment, and there are several that are still outstanding, and we're just waiting patiently for them to arrive. And they have been arriving bit by bit.
Ryan Broom, CBC News. Minister, would you be able to say if the 5 people that were identified, the 5 staff members, do they have worked in the same physical space, or are all of them in the same department?
That would have to be answered by Minister Forde, please.
The recent 5, 3 work directly in the office. The other 2 are senior home health officers.
Are there any other questions at this point?
Yes, yes, Acting Prime.
Sorry, Ian. Yes, Acting Prime Minister, one more question for Minister Bostic, quickly.
Okay.
I await your question, Barry.
Yes, Minister, can you give us just an update on the condition of the persons who are still isolated at this time? Do we have any persons who are either severely or critically ill that the public health officials are paying special attention to? Are any of them ventilated on respirators? What can you give us in terms of the ones who are isolated?
Well, up to the last report I received, which would have been the report for yesterday, we were doing quite well, and we did not have any persons in critical condition.
What about recoveries today? Any recoveries?
None today. As a result of the 53 results that we have obtained, but there are another 122 that are outstanding, so I'm not in a position to say at this time.
And based on the numbers that was just given to us by the acting Prime Minister, our total cases now would be 79 then? 77 from yesterday?
I believe the number is 79.
Thank you.
You're
Go ahead,
welcome.
Ian.
Yes, Colonel Bostic, I was wondering, I remember correctly, you were saying there were 27,000 kits. Are any of them going to be apportioned for random testing at supermarkets to find out a better spread of what Barbados is facing?
No, Ian, I would have indicated previously that there's some established sites. We've been conducting testing, for example, at polyclinics. The Eunice Gibson Polyclinic, for example, would have done about taken about 50 samples only yesterday, I believe. And those sites have been established. We've also established a testing facility at the Gemens Lane complex, where the field medical facility is set up as a respiratory center. And they're also doing taking some swabs for us and some samples for us. And we are also in collaboration with the Barbados Association of Medical Practitioners in terms of getting those private sector entities to be able also to continue and escalate the taking of samples and the referral of persons to the EOC.
Good morning. The czar would have said earlier this month that Barbados still has some way to go before it reaches the peak of its COVID-19 infections. Based on the number of tests we've done so far and the trends that we've been seeing, not only in Barbados, but in the Caribbean, are we any wiser as to when we could expect to see that projected peak in cases?
Well, I'm afraid at the moment I actually deal with the operations on the ground and trying to keep Barbadians safe. There's another group of people who deal with the statistics and the scientific evaluation and so on. So I am not able to give you that information, but all I can say to you is that we are managing quite well that which we are managing on the ground at present.
Okay, Minister Bostic, Anesta here. Can you please answer what additional plans are in place to protect frontline workers at this time? And are we testing frontline personnel at airports and ports since we have expanded the testing criteria?
Well, let me deal with the last one first. As I said again on a previous occasion, we will test whoever is required to be tested, and it would include frontline workers. But you mentioned, for example, seaport and airport. You're mentioning that and asking that question at a time when there's very little activity at both ports of entry. So we are going to do what is required. But back to your question about frontline workers, and especially in relation to the situation with the National Assistance Board, I want to make it very, very clear that we did a lot of work in collaboration with the Ministry of People Empowerment and Elder Affairs, as Minister Forde would have said. What happened is not a result of a frontline worker, as we call it, contracting the virus in the performance of their duties on the front line. Something like that would probably force us to relook what we're doing in terms of doing some retraining and so on. So it was not a breach of any sort. Remember that the person who contracted the virus did so from being in close contact with a family member. And that is very, very important. What we are going to do for the National Assistance Board and the ministry is, as a result of this particular situation, and they have to recruit or bring in additional people to be able to do some of the work, we will ensure that we do for them, in collaboration with the ministry, that which was done for the others.
Colonel Bostic, I was just wondering, finally, if anything is being done to assist small businesses who may have medical supplies at the port that are heat sensitive. If anything is being done to speed up the clearance of those products which may be of assistance in the fight against COVID-19.
I'm sure, Ian, that you would appreciate that that particular responsibility does not fall under the Ministry of Health and Wellness. That is something that, as Minister, I would make representation to the appropriate authorities, but I am not in a position to give you an answer to that one.
All right.
Hi,
My question is for the
I just on that one, Ian, I can assure you though that the Barbados Port Authority has been working with the private sector very closely, and where there are any issues that have arisen in relation to the removal of items from the port that are necessary for whether it's medical side or anything that is urgent, they have been facilitating the process. We've been receiving the requests and we've been responding accordingly to those requests. So I'm not aware that there's any delay in anyone having that necessary permission at this point in time.
Hi, question. Acting PM. With
Go ahead.
regards to small business owners or entrepreneurs, persons are asking if anything is going to be put in place for them, especially self-employed persons.
We have been in discussions with the private sector, and in particular in relation to speaking to the issues faced by the self-employed persons. I know that substantive Prime Minister has also been engaged in discussions with the economic team, and I believe in the course of the next few days, an announcement will be made with respect to the measures that will be taken with respect to that sector.
Acting Prime Minister, with all the job losses and thousands of people filing for unemployment benefits, we hear of cases where employers are not paying the NIS contributions of their employees. Then these employees find themselves not being able to get the benefits which they really need during this time. How big of a trend is this and concern for government, and what is being done to clamp down on this?
We continue to encourage persons, especially employers, to be able to make the necessary filings during this period. I'm not aware that there is a large set of persons who have not complied. Again, we are constantly in discussions with the stakeholders in the private sector, and we've been encouraging businesses. We've been facilitating as well those businesses who have required special permission to be able to have that business conducted so that they can comply. So at this stage, I'm not aware that there's any big concern in relation to employers having not filed at this point.
Have the
Prime Minister
been
Acting Prime Minister, the substantive Prime Minister, Ms. Motley, would have rolled out the Adopt Families program a little over 3 weeks ago, asking persons who make more than $100,000 annually to give generously to help those in need in Barbados. Can you give us an update as to what has been the response to that program?
We've had some very positive responses to the program. I think while there are persons in society who are obviously grappling as well with their own financial circumstances, ordinary Barbadians, businesses have been quite receptive. We've started to see the rolling in of funds coming in, and the unit has actually started the process of going through the list of persons who have been identified as requiring the assistance, and I know that they're working to be able to get necessary assistance to those households.
Numbers in terms of that list, about how many have been identified so far?
I can't say at this stage. I believe it's in terms of the household mitigation, I think it's around 1,500 persons that have been identified. And as I said, the private sector individuals have actually been quite receptive to the program and to being able to help at this time.
And can you round off a number, let's say, that has come in so far? Has it reached 500,000?
I believe it's close to 500,000. Of course, we will always want more to come in to be able to address the various needs, but we welcome what has certainly been given up to date in terms of the donations that have been received.
And how quickly do you expect those disbursements can start for that particular program?
I believe the disbursements, in terms of identifying the households, they've already identified the households, and the assistance is pretty much on train to the various families. As you can appreciate, the assessments have to be done of the families once the lists are compiled. I believe a number had been shared for persons to be able to contact the unit as well. So at this stage, the procedures for those things are obviously already in motion.
Thank you.
Acting Prime Minister, has this situation prompted a check of related government departments other departments associated with the Welfare Department?
At this stage, we are not aware of any impact of other cases, positive cases in any other departments. I think it would be prudent to say to you that across all departments, we've been working very closely with the Ministry of Health and Wellness. Their staff have been briefing all of our various ministries and our staff who are on the front line, and they have been pretty receptive where they have been persons who have been on the front line to be able to ensure that they have been trained. Again, that continues on a daily basis, and the interaction with the Ministry of Health is very much present across all of the various government departments. But I can't say that there's been any other agency or department that has at this point been impacted in this particular way as the National Assistance Board.
Acting Prime Minister Anesta here. What plans are on the card for the easing of the curfew? Will it be a phased approach? What can you share with the nation at this time, please?
At this point, I think we're re-examining the current directive. I think you would have seen last week we made some allowances for persons who had, the public had indicated there were some concerns. The committee is listening and certainly taking note of those concerns, but we're obviously always trying to balance the public health concerns as well. We made those relaxations known to the public. We continue to hear from the various stakeholders, and I believe sometime next week a new directive will be given in terms of the way that we proceed. Obviously, these new cases have perhaps put us in a different position than we would have been a few days ago when we were getting all straight, no positive cases. And I think Barbadians need to be mindful of that as well, that we're not trying to keep them on lockdown or to limit their activity for any other reason than it is for their safety at this point in time. But the Ministry of Health must be allowed to conduct the necessary tracing and to be able to guide the government of Barbados as it relates to any extension of the curfew or any ending of the curfew or any variation of the curfew at this point in time.
Prime Minister, this question isn't COVID related. Okay. What I wanted to find out with regards to Parliament yesterday, some lawyers are pushing back against the amendments that were made to the Criminal Justice Act. What can you say? Namely, the one that persons had a problem with is the Juries Act, which speaks to majority verdicts for murders.
I had discussions with the Attorney General this morning, and I know he's in discussions with them as well. I believe that, as with everything, there's always consultation. Everyone is not going to agree with any amendments, but I believe initial consultations take place, and he's assured me that he will continue to discuss with those persons who have raised concerns so that we can find an amicable resolution quickly.
Thank you
I
very
think, my final question, out of an abundance of caution, has Cabinet as a collective group decided to be tested for the COVID virus? Any members or as the collective?
Not as a collective. We haven't taken a cabinet decision to be tested. I think based on everything that I've been told and everything that I've been heard from the Ministry of Health and Wellness, obviously if you present with any symptoms, obviously you should make your way to be tested. But we have been taking all the necessary precautions. A number of our members are obviously, I consider us to be on the front line, but we have been taking the necessary precautions as much as possible. Obviously there's no guarantee in anything, and that's why we've been saying not just to the public, but we've been saying to our colleagues, just make sure that we follow all of the guidelines. You wash your hands, you sanitize, you wear your mask out in public, and you take as many precautions as possible, and obviously ensure that there's physical distancing as much as possible when you are in crowded areas as well.
Okay, following on from that comment, one last question. Some persons are mandating, some retailers are mandating that persons wear a mask, even though the Ministry of Health said that this is a suggestion. Can you clarify that just for everybody across the board one more time? What is it?
Our position has always been, I think you would be aware that in the initial stages, it was not advised that you needed to wear masks. We've said the N95 masks are the appropriate masks and should be used by the frontline workers, and we've asked persons to desist from purchasing those masks or acquiring those masks. But we've also said that cloth masks, particularly as you go about your business in relation to supermarkets, there's absolutely nothing wrong with wearing them. And we actually advise that persons can wear the mask, and we've taken the necessary steps to advise persons persons how to put them on. We've also tried to give you guidance in terms of how often you should change them and also how you should sanitize them. I think with everything, you know, the information constantly changes, but I think where we are now, it is perhaps advisable that persons who are in public or who believe that they themselves may have some kind of whether COVID or some kind of respiratory condition, it is advisable that they wear the mask in public. It protects themselves from others who may also have the virus, but it also protects them from passing the virus on to anyone else. And it really is just a precautionary measure that I think people would be wise to heed the advice that has been given. We've not made it mandatory, but we've basically given the necessary advice to persons to perhaps take a precaution in this situation.
Thank you very much.
Okay.
Question from Minister Bostic.
Bostic.
Minister Bostic, in recent days, we've heard a lot of things coming out of the international arena in relation to COVID, from the extreme to the sublime. One question I have here, though, relates to the reports of clotting and strokes in some patients. Is that something that your medical team is looking at in terms of symptoms, or are we're not there yet?
The medical team has been looking at a number of things. In fact, we've gone to the extent of actually having a video meeting with experts from China who have been dealing with patients, COVID patients, so that they could pass on to us any information. And that kind of information the medical team has found to be very, very useful. But naturally, I'm not going to speak on anything in relation to clinical matters. But what I can say is that we have people who are following all streams of information, especially coming from sources like World Health Organization, the Pan American Health Organization, and based on that information, recently we had a video call, for example, with some technical persons, some doctors from Canada. That was very, very useful, very informative, and we will continue with that kind of collaboration, and then those with responsibility for medical or clinical matters will make those determinations as to exactly how we proceed.
Minister Bostic, a health and wellness question, particularly. In the last 2 weeks, I've been bombarded by questions from colleagues as well as normal citizens regarding the inability to exercise due to the curfew. And you, from this health and wellness perspective, you surely would understand. A lot of Barbadians still want to see some ease as with regard to their ability to practice good health and wellness. Is this something that has come out of discussion that could be, if not lifted, we see some ease in terms of allowing Barbadians to just become more active?
What I can say to you, it's a good question, and we are looking at it from a health perspective, but anything to do with a relaxation of measures or even a tightening of measures cannot be viewed in isolation. So we cannot look at it purely from a health perspective, but those are discussions that are held with a larger body, including all of the relevant persons, and those persons then being led by the acting Prime Minister or the substantive Prime Minister, then decisions are made. But it is a legal matter in terms of the curfew, but there are discussions including all sectors that will help to guide how we proceed going forward. But it's a good question, and we are studying it at the Ministry of Health from a health perspective.
Thank you.
In closing, I just want to thank both Ministers Bostic and Minister Forde, who have been able to provide much valuable information this afternoon in relation to the situation with respect to COVID-19 and a number of persons who have tested positive at the National Assistance Board, but also to provide a wider appreciation for what is happening in the country in relation to testing and certainly contact tracing. Again, I want to remind Barbadians that we are in a difficult period. We are all in this together, and I would want to urge you to continue to heed the warnings, the various messages from the Ministry of Health and Wellness, so that we can get through this period, which is very difficult for all of us, together. At this stage, I just want to thank you all the questions from the media, and I continue to appreciate the efforts that you're making to be able to disseminate the information from the government of Barbados as we go through this crisis. Thank you.